How are you?
Hi, alright.
I see you're having some anxiety problems.
Yeah, just a little bit.
While I was going through your medical history questionnaire, as you have filled it out outside, I saw that you also wrote as your middle name as anxiety.
Yeah, I have a lot of anxiety. Just being in this chair makes me anxious. Talking to you makes me anxious. I don't know how, but you can ask me anything you want to, but I'm really anxious.
Do you go to Harcum College? I didn't know it.
I do. It's my first semester.
That's nice. Do you have Mrs. Greenlee?
I do, actually.
Watch out for her. Mrs. Greenlee, she's kind of tough at the end.
Really? She seems so nice.
But she actually does get tough later on.
Great. One more reason for me to be anxious. Okay.
Don't worry. Don't be anxious. It's fine. So, do you carry any medications with you since you have
I do. I take lorazepam when I know that I'm going to be anxious, although I didn't take any today because I just didn't know if we were doing anything today. I thought maybe we might just be talking, so I didn't want to take any medication if I didn't have to. But if I do have to, it is in my purse, and my purse is located on the wall.
Okay, no problem.
What are you doing?
Hey, I'm just trying to put you back so I can just look at your mouth.
You said that we were just talking. We just need to talk today. You might don't want to go in my purse.
Are you getting it?
Because you started to put me back.
Okay,
and you said that we were just
breathe through your nose. Breathe through your nose. Calm down. Loosen your clothing while you are relax. Try to relax. Try to relax.
Then you want it.
Lorazepam dose 1 to 2 millimeters. Here, you can just hold it. Don't take it. Don't take it. Hold on, hold on, hold on. Just put your sweatshirt.
Next time. There is a next time.
Just calm down. Calm down.
You have to tell me that you're putting me back.
Okay. Sorry for that. But just calm down. Relax. Don't think of anything. Don't even think you're in clinic. Relax.
It all started when you talked about Greenlee. I was part of it.
Sorry. I won't talk that again. Sorry, Mrs. Greenlee.
Okay. I feel better now. I think.
Just relax. We're just going to talk today. We're not going to do anything.
Hi, I'm Dallas, the receptionist at Super Smiley's Dentistry. Today, we had an accident with one of our most beloved patients, Kristen Carrozza. Thankfully, our hygienist was able to quickly act in this emergency. Kristen has often had a history of anxiety and experienced symptoms today. Hyperventilation can be caused by fear or anxiety of the dentist. The predisposing factors of hyperventilation are being at high altitudes, being pregnant, taking central nervous system stimulatory drugs, aspirin toxicity, and anxiety or fear of the dentist. The signs and symptoms of hyperventilation are rapid deep respirations, heart palpitations, lightheadedness, apprehension, trembling, and, in a most severe case, unconsciousness following stress-induced deep rapid breathing. One of the ways to treat hyperventilation is by taking lorazepam. Thankfully, Kristen had hers on her, and we were able to inject it intramuscularly to help reduce her signs and symptoms. Many people think that a brown bag is the best way to treat hyperventilation, but this is no longer true. Kristen, how do you feel following this emergency?
I feel great. I'm very thankful for the care that was given to me by Bomika at Super Smiley Dentistry, and I will return, but with my lorazepam.
Thank you, Kristen. Hi, Kristen. I'm Dallas, hygienist. I was looking through your medical history. I see the last time you were in, you had an anxiety attack.
Pretty much.
Okay, and do you still take lorazepam for that? Or?
I take it when it happens. I don't take it on a daily basis. I didn't take it today because I've been a lot better, so I do have it, but I don't even really take it as much. I want to try not taking it.
All right, that's good to know. Any other medical issues I should know about?
No, not that I know of.
All right.
Let's get started.
did you go to school for your hygiene degree?
I went to Harcum.
Oh, okay.
Yeah.
I just wanted to know.
I see you go there too?
Yeah, I started.
Okay.
I just wanted like to know where my hygienists work.
Yeah. All right. I'm going to start with putting some gauze in your mouth just to make sure everything's nice and dry. Okay. Are you having another anxiety attack? Oh no, you're choking. Okay. Oh no, you're turning blue. Okay, turn on your side. Now try to keep coughing. Okay. All right, Kristen, just drink the water. How are you feeling?
Much better, thank you.
Okay, good.
Is my color back to normal?
Yes, you look
Okay.
back to normal. No more cyanosis.
Okay. Thank you very much for all your help.
You're welcome. I'm glad everything's okay.
Yes, it is. And I'll still come back to Super Smiley Dentistry for my next cleaning. Thank you.
Hello, I'm Bhumika and I'm a dental assistant at Super Smiley Dentistry. Today we had a medical emergency, airway obstructed, with our very well-known patient, Christine Carrozza. It was very easy for our hygienist to perform the act because Christine was already in a supine position and was choking on the cotton roll. Since Christine was in a supine position, we just told Christine to turn over and cough the cotton roll out. But if the patient is unable to cough on their own, do Heimlich maneuver. If the patient loses consciousness, then you should lay them back in supine position. Then clinician should open the airway and attempt to ventilate. If air enters the lung, then continue with ABCs of CPR, which is airway, breathing, circulation. If it does not enter the lung, then chest compression should be performed 30 breaths to 2 compression for 5 cycles. This should be performed until EMS arrives. If object appears in throat, perform a finger sweep. Situations like these can occur unintentionally, so it is better to have some knowledge and be prepared. Thank you.